Most people know about non-small cell and small cell lung cancer, but there is a third, lesser-known category that affects thousands of patients every year, and it behaves very differently from anything you may have read about. Today, we are talking about neuroendocrine lung cancer. Neuroendocrine lung cancers arise from specialized cells in the lungs called neuroendocrine cells, cells that help regulate breathing and other vital functions. Pulmonary neuroendocrine neoplasms account for approximately 25% of all lung cancers, making them far more common than many people realize. They fall into two key groups: neuroendocrine tumors, or NETs, and neuroendocrine carcinomas, or NECs, each behaving very differently in terms of growth speed and spread. There are four main types, ranging from slow-growing to aggressive. Typical carcinoid, grade 1. Slow-growing, less likely to spread outside the lungs, most treatable with surgery alone. A typical carcinoid, grade 2, grows faster than typical carcinoids and is more likely to spread. Large cell neuroendocrine carcinoma, grade 3. All neuroendocrine carcinomas are grade 3, fast-growing and aggressive. Small cell lung cancer, also a neuroendocrine carcinoma, highly aggressive and fast-spreading, requiring immediate intensive treatment. These lung cancers are treated very differently from one another, so knowing exactly which type you have is critically important. Symptoms can vary depending on the type, but common signs include a persistent cough, shortness of breath, chest pain, wheezing or recurrent pneumonia, particularly in typical carcinoids, which often grow in the central airways, coughing up blood, known as hemoptysis, carcinoid syndrome, flushing, diarrhea, and wheezing. When tumors produce excess hormones like serotonin, treatment depends entirely on the type and stage, but options include surgery, the most common treatment for carcinoid tumors, which are often highly treatable, radiotherapy and chemotherapy, used particularly for higher-grade tumors and NECs, somatostatin analogs, which help control carcinoid syndrome and slow tumor growth. Novel targeted drugs like atezolizumab, emerging as effective options for advanced disease. Neuroendocrine lung cancer is rare, but it is not without hope. The key is getting the right diagnosis, the right type identified, and the right treatment matched to your specific cancer. If you or a loved one has been diagnosed, ask specifically which type of neuroendocrine lung cancer it is. That answer shapes everything. Like, subscribe, and share this with someone who needs it today.